Hi, it's Dr. Joe Markovich, the anti-aging doctor in beautiful Charleston. Talk to you about chiropractic tables, adjusting tables. A lot of people have used these stationary tables in the past, and of course osteopaths have used stationary tables. All they were like an examination table, but they were tall. They were, I'd say 36 inches at least. And you examine and treat on the table. They call them manipulations. We call them adjustments. In the past, osteopaths were very good at what they did. They adjusted the spine as chiropractors did. They called them manipulations, but they were still adjustments. And even their philosophy is a little different. But they've kind of gotten away from it. It turned really basically into medical doctors, no different from an allopathic physician. Allopathic physicians are physicians that give drugs for symptoms. Well, anyway, these taller tables had their benefit. But what do you do when you get a really big patient, a person who's 400 pounds? Well, you got to lift. You're too high up. You can't work on them. You hurt your shoulder. You hurt your back. You got to get a low table when you have someone that size. A lot of these chiropractors have really gone to these adjusting instruments because they can't do it anymore. They've hurt themselves too much. Well, I'm into protecting myself. You need to get a table in a position that you can keep your arms in and your legs in. Don't lift your legs up. Don't do that thing where you lift your leg. Don't do the thing where you try to push off a wall. You're going to twist your pelvis. You're going to twist your back, get a torn pelvis. The portable tables had their benefit. Of course, you can go anywhere with them. A lot of them now have like drop pieces, and which are good. They save your back. I'm talking about how to save the chiropractor's back while helping the patient maximally. But I do like these electric tables that elevate and lower. I mean, there's some downsides to them. One of the ones I have, when you get to a certain level, it's unstable. So you don't really want a table that's unstable in any of its motions. I do like the Electra stationaries and the Electra high-lows. They have high-low tables. A high-low table would be a table that goes from vertical, and the patient gets on it when it's vertical, and then it lowers to horizontal. It's easier on the patient, but I don't think it's really that great for the chiropractor because one, it just takes so long for it to happen. They break easily, and they're hard to fix. You can't find somebody to fix them for you. They're basically you're screwed on that. You can't take care of it. I like just the regular ones that elevate. Just go from lower elevation to higher elevation. They help me, and when you adjust, you want that patient really almost at waist level or higher if you can handle it. But you keep those arms and elbows in when you adjust, and that's the best way to do it, to protect you. The tables that I use, I'm not real crazy about them. I didn't get all the drop pieces that they need, and plus the equipment on them doesn't seem that sturdy. Those electrostationaries were the best ones I ever had. I had those things for 20 years, and they never broke. I'd lose a screw here and there, but those things were fantastic. So I do like those babies, and if you can get them used somewhere, more power to you. It's a great table, and I'm not getting anything from that. I'm just telling you that was one heck of a table. I wish I had them back. I sold them to these kids, but I didn't have the high-low ones. I had the ones just for stationary. I sold them to these people. I think I sold them for $300 a piece. Oh, I wish I had those back. Those things are great, and I would gladly take those things back. But I do like the high-low because my back has gone bad from all the adjustments that I've given. You really want to protect yourself. And that's really the key to chiropractic. It's like most of the people in it got worse backs than the patients they take care of. To keep yourself good, you got to stay in close to that table. The table has to have elevations, have drop pieces, cervical, thoracic, and lumbar. But I don't like those distraction tables that flexion distraction. They flex down. If you think about how the spine works, the reason that the discs rupture is because they've gone into abnormal flexion with their spine. They've gone into abnormal flexion, and that's caused the disc to rupture posteriorly or laterally. And maybe it's just me, but it seems like everybody I know who's ever used those things has gotten a rupture themselves. I don't think that's the answer. You need to take care of your own back. So flexion distraction tables, no. I like the straight distraction, but I worry about them as well. The intersegmental traction tables helped me a lot, and it seemed as though the spinalator and the Spinalign had the best action. There are other ones out there, but they don't have enough action to them. The spinalator moves off of a spoke, off of an axis, and it twirls around the axis, and it has 3 different lifting portions to it, and that seems to really help the back. I recommend those if you do have a bad back and use those. I'm going to go back to them. I had them for years, and I didn't realize how good they were, but they really help your back, and I think chiropractors need to use those. And the inversion table, which is my favorite table, and you can adjust on them, and someone has developed a way to adjust on them, but I haven't used those yet, but I think that would be really good for a patient to be in distraction while you're adjusting. But like I say, everybody wants to go to these instruments, but I am not in belief that they really actually move the bone. They do work on the fascia, the trigger points, and the muscles and tissues, but I don't really believe that activity moves the bones. I have no proof. I've never really seen anybody get significantly better from that. So anyway, take care. It's Dr. Joe. I just wanted to tell you about chiropractic tables, equipment, and all those good things. Take care. Bye.